Dr. Fine was still protecting us from his worst suspicions. Both he and Shawnee secretly felt that Ariel should be tested for AIDS as a precaution. Shawnee convinced him, and they debated how they should approach us. Since doctors need legal consent to test for AIDS, and since they didn't want to confront us with the HIV test, they decided to run tests that might rule out AIDS as a diagnosis. When the test for leukemia came back negative, I felt we had won another diagnostic round. I felt relief. Richard Fine wasn't as cheerful. We also found out they had tested Ari's T-cell levels while she was hospitalized. Out of all the tests, the only one that pointed out anything new, pointed toward AIDS, her T-cell count was low. T-cells are the white blood cells that defend one's immune system against attack. The HIV virus infiltrates these cells where it then replicates it in a new T-cell that is produced. The infected T-cells die off. So, as the disease progresses, T-cell counts make a long, slow decline, robbing the immune system of the very cells it needs to fight off infections. Dr. Fine had asked the hematologist to take a look at Ari's blood work. I was unaware of his mounting fears. I still believed that once we diagnosed Ari's illness and treated it, everything would turn out fine. But no matter what I believed, it was a stressful, scary time. I needed support. I was already facing issues I never thought I'd have to face. 2 weeks later, I got a call from Dr. Fine. Look, I don't want you to be anxious about this because I'm sure it's not possible, but the hematologist who has been studying Ari's blood work passed it along to the infectious disease people, and there are a few things in the picture that make them feel it would be smart at this time to test for AIDS. Okay, all right, I told him. By then, Richard and Shawnee were almost a part of our family. I had complete faith in them. We've tested for lupus. We've tested for leukemia. We'll test for AIDS. I don't think I was any more anxious about the AIDS test than I was for anything else. How could Ariel have gotten AIDS? I wasn't worried about her transfusions in Miami because she was already sick by the time she got them. Just as her doctors had ruled out lupus and leukemia, they'd rule out AIDS. But Paul was livid when he heard that Dr. Fine wanted to test for AIDS. It seemed preposterous to him. He called Richard Fine, furious that the illness had been going on for 6 months without any resolution or improvement. Although Ariel wasn't getting any worse, she certainly wasn't getting any better. Paul was petrified by the thought of AIDS, but once he vented his frustrations, he finally agreed to let them do the test. We went in, and they drew the blood. I had to sign a form that gave them permission to test for AIDS. Paul was home when the phone rang the next day. We were in the bedroom. He answered it, and I saw him nod and mutter something like, uh-huh. And when he hung up, he said, they've got to run it again. It's shown some kind of positivity. It's probably a mistake, and we'll know in 2 days. It was 2 days that felt like a lifetime. I don't remember talking to Paul about it. If one of us had started talking about it, the other would have said, look, this is silly. We don't even know. It's a waste of time to even speculate. In 2 days, we'll know what's going on, and it probably is going to be fine. I remember telling a few friends that the test was being repeated because there was something quirky in the results, and it was probably a false positive. I was truly in shock. I only went through the motions of acting positive for Ari's sake, and the 2 days passed slowly, but they did eventually pass. Richard Fine called that morning in late May. The test has come back positive. You all have to come in tomorrow to be tested. At first, no words came, and then I blurted out, how could this have happened? How could this have happened? We don't know. We need you all to come in and be tested. I'm so sorry, Elizabeth. Ari had been diagnosed. Ari's illness now had a name. Ariel had AIDS.